This is a short lecture on tumors. We have what's called primary tumors, which originate in the eye. And in the lids, the most common are basal cell and squamous cell. The basal cell is locally invasive, slow growing, most common. The squamous cell is much more aggressive, it spreads, and it metastasizes. In the iris, we have malignant melanomas that can form there. They're very aggressive and they metastasize quickly to the nodes. In the choroid and the retina, we also have malignant melanomas, and we have one called a retinoblastoma. Secondary, they can go to any part of the eye and the lacrimal gland from any other body area. Lymphomas are not uncommon. They are metastatic from the breast and lungs. This is our most common metastatic lesion to the eye. Breast, lungs. They go primarily to the retina, the choroid, and the iris. In the conjunctiva, lymphomas are the primary one that go to the conjunctiva. And note, a tumor in the retina or choroid can frequently masquerade as a retinal detachment. Here's some different tumors. This is a basal cell, which is locally invasive. You would excise that with a wide excision here. Send a frozen sample in and make sure you've got all sides and deep. This, on the other hand, is a very invasive squamous cell. It's already way out here, and this squamous cell does metastasize. This is a malignant melanoma in the eye. You notice it's not all brown. This, you say, gee, that looks bad, but that's just a pigmented nevus in the iris. This funny looking little thing, which mimics a basal cell because it has these inverted edges, but notice it has this keratin plaque in it. This is called molluscum contagiosum. It's the pox virus. And these are benign, and you can freeze these off or cut them off. Several years ago, my son went swimming in Lacamas Lake, and within 2 or 3 days, he developed about 10 or 15 of these all over his chest. And he had to have them frozen off, and being a young teenager, this wasn't a pleasant thing for him. These are just viruses. So, eyelid tumors. Basal cell, again, most common, locally invasive, doesn't metastasize, but does require surgical excision. If it's a very tiny one, there is a topical drug called imiquimod, called Aldara, and you can put this on. It's used to treat genital warts also, and put it on daily for a number of times, and it can get very small basal cells to disappear. Squamous cell carcinoma, invasive, metastasized, can be fatal. You've got to remove all the cancer tissue. Both of these can be mistaken for chalazion, so sometimes you have to biopsy it to get the diagnosis. And so you really can't tell all the way time by looking. This is an early squamous cell. This could be almost anything in here, This could be a squamous cell. It could be a chalazion. It could be a basal cell. And again, this is molluscum contagiosum. So here are different things here, and they get hard to tell what they are. It's causing ectropia in this in here. It could be basal cell or squamous, and this one turns out to be a basal cell. This looks like a squamous cell. Whoop, down here, this was a squamous cell. Couldn't be sure. That was squamous cell. That looks like a papilloma wart, doesn't it? It is, but it isn't. But it's a benign intradermal nevus, but you can mistake this for a basal cell. So you can't always tell until you have a biopsy of these. How do we diagnose it? We do biopsies, and you'll be helping the doctor with these a lot of time. But what you do is you remove a small area of the lesion to determine the diagnosis, and you put it in a container like this, and this is sent to the pathologist. And you can do a punch biopsy with trephines. This is done with local anesthesia with 1% lidocaine. Start remembering this drug here. This is the anesthetic of choice, probably 95% of things we do. Now, if you can take the whole thing out like this when you're trying to excise it, and maybe you put a suture around this edge here, and then when you send it for a frozen section, the pathologist examines all these areas and of course the depth of it to see if the tumor has been completely removed. And he said, well, you might get it back. And he said, well, this edge here, you need to take a little more. Now, melanomas. This is pretty obviously a choroidal melanoma. You don't even need a 3D on this to tell that this is elevated in here. But when you look at this, you say, gee, it's kind of a mean looking thing, but actually that's just a choroidal nevus, a benign melanotic lesion. And you can use B-scan ultrasound here to see this, and here's this tumor right here. And now here's another one that doesn't look a lot different from that one, does, but this one turned out to be melanoma, a malignant melanoma. Used to be we had to take the eye out when they got those, but now they have implants and stuff that you do their radiation and not have to remove the eye. I had, when I was in the Navy, I had a chief who we had to remove the eye. His name was Dempsey. I can remember him because his wife owned a macadamia plantation in Hawaii. And so every time he would come in and visit us, he'd bring us some macadamia nuts with chocolate. And gee, we had to keep seeing this chief for a long, long time to make sure that didn't come back, and to make sure we had plenty of chocolate-covered macadamias. So lymphomas here. This is the most common thing in the conjunctiva. Lymphoma is a type of blood cancer that involves the lymph nodes, the spleen, the bone marrow, and the other organs. Sometimes it'll involve the lacrimal gland. They have fever, night sweats, weight loss, fatigue, trouble breathing. It's more common in females after the 50. And when the conjunctiva is involved, it can be mistaken. You can say, gee, this looks like a chronic conjunctivitis. Maybe it's chlamydia just hanging on in there. But look at this color. It's a salmon pink. This is called a salmon patch. And that's pretty diagnostic of a lymphoma. So you take a biopsy of that, and that would prove a lymphoma. Now, if the patient has already had the diagnosis for lymphoma of the rest of the body, you'd pretty much know that. But sometimes you come in and this is the first place and it is diagnosed there. So breast and lung cancer are the most common metastasis to the eye, and they usually go to the retina and choroid. They can have all kinds of ways to look here. Here's a breast metastasis, a retina choroid, and here's breast metastasis to the iris. Showed you the lymphoma here. Here's another salmon patch of it here. So this is on the down in the cul-de-sac, and this is out on the conjunctival ways. And as I mentioned, this is frequently mistaken for chronic conjunctivitis. Retinoblastoma. This is a rare form of ocular cancer that begins in the retina, and it's usually found before the age of 3. It is the most common malignant intraocular cancer in children. It can be bilateral or unilateral. Sometimes it'll present as a white reflex when they take a picture, or maybe the child has developed a little strabismus because the tumor is causing some amblyopia in there. But it has one of the best cure rates of all childhood cancer. Look at that, almost 98%, with more than 9 out of 10 living into adulthood. Here's a big one back in the eye. When I was in training, these eyes had to be removed, unfortunately, and sometimes you had a bilateral and you ended up with having to remove both of them. Now they have radiation implants and other things they can put in that, and the child can have the eye saved and have reasonable vision if it doesn't involve the macula into adulthood.